Hey, it's Kajin, and I'm here to speak to you all about juvenile diabetes, aka type 1 diabetes. Etiology. Diabetes mellitus is a chronic autoimmune disorder of metabolism which is characterized by partial or complete deficiency of insulin. Type 1 diabetes is a destruction of pancreatic B cells leading to little or no insulin being produced by the pancreas. Type 1 diabetes occurs as a result of the body's immune system attacking the insulin-producing beta cells of the pancreas. Although it is not clear why this happens, a lack of insulin in the blood means inadequate amounts of glucose are taken up by the cells of the body to provide energy for cellular function. More than 60% of patients with type 1 don't develop serious complications over the long term, but they can experience blindness, end-stage renal disease, or in some cases, early death. So for treatment, we want to replace the insulin that the child is unable to produce. We want to maintain near normal levels, which would be levels less than 126 and an HA1C of less than 7%. Rapid acting reaches the blood within 15 minutes with a peak of 30 to 90 minutes. Short acting reaches the blood within 30 with a peak of 2 to 4 hours. Intermediate reaches the blood 2 to 6 hours and has a peak of 4 to 14 hours, and long acting takes 6 to 14 hours to start working and has a peak of 10 to 16 hours. There is no diet restriction for diabetic children. However, meals and snacks should be according to peak insulin action. You want to encourage exercise and not restrict it. You do, however, want to provide extra snacks before any activity. Most children are usually able to control their disease. However, instances such as illness, surgery, or ketoacidosis may change this, and this is when these children will come to the hospital and where nursing management comes into place. Children with DKA require intensive care. It's important to monitor vital signs, weight, IV fluids, electrolytes, blood glucose, and I's and O's. When the period is over, then you can begin regulating the dosage of insulin again. Nurses should encourage parents to obtain a medical identification band for their children. When teaching children and parents about injection procedure, we want to teach them the technique, area, and rotation. For area, we want to teach them to find adipose tissue and then to always rotate the site. Nurses should be prepared to teach and supervise blood glucose monitoring. This can be done mechanically or with a blood letting device. You want to get a sample from the fingertips, or you can use an alternative site such as the forearm. When it comes to hygiene, you want to caution children against wearing shoes without socks, wearing sandals, and walking barefoot. It's important to have correct nail and extremity care. Their eyes should be checked once a year, and cuts and scratches should be treated with plain soap and water.
Created using Powtoon.